Hi, Rachel.
Hi.
So, can you tell us, how did you come up to come up with the idea to write this paper?
Well, I think it came up with me actually. So
Hmm.
it was so at the time I qualified as a psychoanalyst in 2008 at exactly the same time as I got my first inpatient consultant
Ah,
role.
hmm,
And I worked my first role for the first 5 years was working as an inpatient consultant. So
right.
seeing people who are really, I mean, at that time it was also where psychiatric beds were reduced. So only the most seriously mentally ill or people
Hmm,
suffering in the most severe way were admitted to psychiatric
hmm,
wards. And during this time, I became absolutely obsessed with the ideas in this paper. So every time I was teaching medical students, almost every week, I'd be going through this, sort of
hmm,
trying to get them to think about loss
hmm,
and trying to work something out. And it took
hmm,
quite a long time for what it was that was emerging or what it was I was trying to think about to emerge. And for a period of time, I was just very, very obsessed with it. And
hmm,
I think the aim really because if you were trained in both psychiatry and psychoanalysis, it felt as though you're looking at something from two different perspectives. And what is
yeah,
quite surprising is the lack of curiosity
hmm,
when you're in one perspective, the lack of curiosity about the other perspective. And
hmm,
both perspectives felt to me to be equally valid for the patients that I was seeing. And they did seem to make sense together, but it was trying to work out exactly how they came together.
I
um,
see.
and how the sort of psychoanalytic understanding and the focus that there is in
Hmm,
um, a lot of the psychoanalytic work, what I felt the whole focus had been through my training, which was
hmm,
on the importance of loss and mourning,
hmm,
where this came in with psychiatry, but also what was the meaning of psychiatric diagnosis. So again,
hmm, hmm,
psychiatric diagnosis felt very important. It felt like it had a lot of meaning about something, yet it was very difficult to try and make sense of what that meaning was.
hmm.
Um, so it was I suppose, very broadly an attempt to try and find meaning and
Yes,
link
yes.
between the
The
psychoanalytic.
huge loss event you're saying is, the coincidence of your sort of qualification, graduation, and then equally the loss, the profound loss that you experience, one would imagine you experience on an inpatient setting as patients are admitted to inpatient care.
Yeah, well, I mean, you're surrounded by loss.
Yes.
What you
Yeah.
notice, what you notice when you're working in a very serious psychiatric environment, and I think it's something that isn't appreciated about psychiatrists actually,
Mm.
is that you are working in amongst an absolute sea of loss.
Yeah.
To
Yeah.
develop a serious mental illness that necessitates an admission to a psychiatric ward
Mm.
is a profound loss in itself.
Yeah.
Never
Yeah.
mind the losses that have brought you to be in
Mm.
that position.
Yes. 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 Yeah.
It felt almost as though all the patients were singing about loss,
Ah. Yeah.
everything that they
Yeah.
talked about, and their
Yeah. Yeah.
families are trying to deal with this.
Yeah. Yeah. So your work is sort of saturated then, right at the start of the sort of conceptualization of this paper with loss. And I wonder if you could tell us about the main themes then in the paper and your kind of overall aim. You talk about two different worlds, and I wonder if that is part of the aim of this paper to bring something together for these two different worlds.
Totally,
Mm,
totally, because for me, it felt like what is an integration. I think there's been a profound split between
mm,
the psychoanalytic understanding and the
mm,
psychiatric.
mm,
The psychiatric holds something sort of paternal. I think
mm,
psychoanalytic holds something maternal, and it's as though there's been a very serious divorce,
mm,
sort of biological from the psychological,
mm,
as though for each the other doesn't exist, and it's not the
mm.
case.
Yeah.
And you
Yeah.
can
Yeah.
see in psychiatric settings the very major importance of medication, for example, in severe mental illness, which I think again can be totally not engaged with in a
Mhm,
psychoanalytic or a psychological setting.
mhm, mhm, mhm,
So very much the themes were about trying to bring out and make clear the importance of loss, because also what all the patients were talking about with the severe loss events that they had suffered before they developed their illnesses.
Ah, yes.
And the second part is trying to understand why the people in front of you are presenting with different mental illnesses. We
Mhm.
classify them differently. So someone's got OCD, someone's got a psychotic illness, someone's got depression, someone's got anxiety, as though these things are different. and totally different from each other, but they're not. But what makes one person present in a particular way and someone else present in a different way? And that was a very perplexing and preoccupying issue for me.
Yeah.
And I suppose the main theme in the paper is about that the illness, the symptoms of the illness are determined by the psychic defenses that are overused at different stages in the mourning process. So that the mourning gets blocked. The psychiatric illness, as Freud described in Mourning and Melancholia, psychiatric illness is a response to a sort of blockage in mourning. But the illness actually presenting is determined by the psychic defenses used by that individual at that point in time.
Yes, yes, yes. And it sort of brings a picture, a very vivid picture that perhaps as psychological therapists, we're sometimes a bit further down the road, aren't we, in terms of meeting patients than the very traumatic experience of inpatient, and which seems to have stimulated your paper so much.
Yes, and there can be I think there can be a lack of respect and understanding both ways.
Yes, yes.
Of what and a lack of compassion between the different sets of practitioners, which I think is very painful if you're engaged with both, if you care and value about both.
Yes, of course, of course. How has your paper been received?
Well, I think by the psychiatric community, I'm really surprised and was hugely relieved that it actually seems to be being received in a very positive way, and it was the paper of the month. That the Royal College promoted it and sort of celebrated it in a way, and I was very surprised about that. But actually, it does fit in with my experience as being a psychoanalyst working in sort of acute psychiatric settings. What I've experienced and what I'll try and say repeatedly is that I think the applied psychoanalytic thinking within these settings is met with huge relief and pleasure and is welcomed. So I think this sort of supports that idea. And at the time that I completed my training, there were very, very few psychoanalysts working in frontline psychiatric services. I think there are more now. But what I think is that you are very welcomed in that environment, or I felt very welcomed.
Yes, yes.
The analytic thinking was very welcome.
Well, before you go, I just wanted to let people know you are going to be doing a much more in-depth presentation of this paper and discussion on the 15th of June at the Institute of Psychoanalysis. And I think there are still places if anybody wants to book on. What will that presentation bring? Will it just give you a bit more time and a bit more space to go through in more detail some of the aspects of the paper?
Well, I'm hoping to have a discussion with David Bell and find out what his thoughts are about it, but also with the people that join the presentation. I'll be very, very, very curious about what this brings up for people, and what people's thoughts about. Do they think it's a valid way of thinking? I mean, does it make sense? And I think by getting that feedback, it makes a huge difference to thinking going forward.
Yes, yes. Hopefully the audience can represent these different sort of sides and the bits in between. Yeah, great. Rachel, thank you very much for joining us, and all the best on the 15th and with these other papers.
Thank you.
Bye-bye.
Bye.